Hi, thank you for joining me. My plan was to continue covering topics around ADHD. It's a huge topic, and I know a lot of people are struggling with it right now. I get a lot of requests for that information in my clinical practice. But another issue keeps showing up with my patients, and I just felt like it might be good to cover a little bit of that here. I don't know how big a topic it'll turn out to be. It is a tough one. I'd like to talk about trauma and trauma-informed care. Two big topics in medicine right now, and frankly, they're topics we in medicine don't do a great job dealing with. By the end of today's video, I really hope to tackle the tough question of why healthcare does so poorly with trauma. I think that's a really important question to start asking. But first, we have to lay down some groundwork, kind of explain what trauma-informed care is. Probably also we need to cover how that connects to attachment styles, and then we can dive into why healthcare providers may struggle with being sensitive to those two areas. I think it's an important topic. I think it has a lot to do with the quality of care that many patients receive, so I think it's an important discussion. So let's break that down a little more. To be truly trauma-informed, a system of care has to be aware that most of the patients they're treating have experienced some form of trauma. So let's jump into the topic by describing what trauma-informed care actually is. Trauma, of course, is at the core of trauma-informed care, but it goes a lot deeper than that. When applied correctly, trauma-informed care means every piece of the healthcare delivery system, from the person who greets patients at the front desk, to the clinicians within the hospital or the clinical setting, to the administration, even to less associated personnel like the folks who work in the cafeteria, the folks who work in security or administration. All of these individuals should be educated and informed about the unique challenges that individuals with trauma sometimes face. The topic of trauma is massive, and it's well beyond the scope of the question we're asking today. What we're looking at today is why healthcare delivery struggles to engage with people who've experienced trauma in a really positive way. So for our purposes, I think understanding a little bit of how we view trauma in childhood and how we view child and adulthood is probably enough to have the discussion. In children, it's pretty common to talk about adverse childhood events. These are the types of events that are known to cause children trouble in development and even into later life. The general thinking is that the more adverse childhood events an individual has, the more burden of trauma that person experiences. It really isn't saying anything about what that person's life might become or what it is today. It's really just a measure of understanding how much trauma that individual has lived with. And to give you a feeling of what kind of trauma we're talking about loss of a loved one by suicide, exposure to domestic violence, or neglect, or abuse, or homelessness. It's really the major life events that might shape the life of a child in a negative way. And adult trauma as well, the kind of trauma that leads to a diagnosis like PTSD. And taken in whole, the great majority of us have experienced significant trauma within our lifetimes. So to have a good discussion about trauma-informed care, I think it's important to go the next step, and that is to understand that most of us have some kind of reaction to the trauma we experience. That reaction usually takes the form of a change in how we trust and a change in how we attach to people, or how we interrelate to people. Trust is a little bit easier to understand. Let's tackle that one first. Trust is usually viewed as how much risk we're willing to take in terms of putting ourselves out there for other people. For example, if I don't have a lot of trust, I'm probably unlikely to try something new somebody invites me to, so I'm going to be a little more withdrawn, a little more avoidant, and a little more risk averse. On the other hand, somebody with a lot of trust is really likely to put themselves out there. They might get hurt, and they might learn that they need to trust a little bit less. So we're always adjusting trust in one direction or another, trusting more, trusting less, expecting to be hurt, or expecting to be taken care of. And this is what brings us to the attachment styles that people talk about, with anxious attachment, avoidant attachment, secure attachment, anxious fearful attachment. All of these attachment styles relate to early life experiences, and to some level, they relate to trauma. And because I don't really like surprises, I'll kind of jump to the point here. The most challenging attachment style for healthcare providers is anxious and fearful. It's an attachment style that's characterized by difficulty trusting, avoidance of others, and sometimes pretty serious reactivity. The other three common attachment styles are a lot less challenging for healthcare providers. Secure attachment is easy. Somebody with secure attachment imagines that people are going to want to take care of them. They trust people, and if something goes wrong, they're probably going to look to work it out. Anxious attachment tends to be avoidant. They have a harder time coming in for their appointments, but they don't want trouble, so they're usually not very reactive. They don't get super angry. And then you have the avoidant type of attachment. That type of attachment is usually dismissive of help, isn't likely to come in for care, is less likely to follow through, but they're not especially reactive. They just don't trust people and probably will keep their healthcare provider at an arm's length. And I recognize we kind of flew through the attachment styles, but the whole point of that was that there's one attachment style that healthcare providers in particular really struggle with, and that's the avoidant fearful form of attachment. That's the style of attachment that you usually develop if you don't have a very good view of yourself and you don't have a very good view of other people. And my years of experience working in healthcare, my experience is that most of healthcare delivery struggles with that type of attachment the most. So to help make the connection between trauma and attachment style, I just want to underscore how attachment style is kind of the expression of somebody's lived experience around their relationships with other people from early life all the way into adulthood. So if you have had certain experiences, you're just more or less likely to develop one of these attachment styles. And making that connection to trauma-informed care, the whole point behind trauma-informed care is to understand that trauma has an impact on people, and that impact will be reflected in the style the individuals use when they engage with other people. And to a great extent, that has to do with attachment style. It has to do with other things too, personality traits, intellect, lots of other attributes that people have. And now to make the connection to trauma-informed care, we have to keep in mind that trauma and attachment style have a lot to do with how people engage with others. Whether they trust or whether they don't trust, whether they're avoidant or not avoidant, whether they're fearful or not fearful. All of these things have an impact on how other people respond. And the whole point behind trauma-informed care is that we understand this, and that people, even if they've had trauma, and even if they're avoidant and fearful, they deserve to have the best possible health care available to them. Now, my apologies, I recognize that was a long lead up to talking about trauma-informed care, but without understanding what trauma is and how it generally demonstrates itself within a relationship, even with a healthcare provider, I don't think the discussion would have a whole lot of meaning. So trauma-informed care at its core is really just the whole system of care from the point a person enters healthcare, meaning the person at the front desk knows that most people have experienced trauma. They recognize that people will show up with avoidant behaviors and with fearful behaviors, and they recognize that's part of what taking care of individuals is about. So they're prepared not to be abused, but they're prepared to understand that if somebody reacts fearfully, or if somebody reacts with avoidance, then that healthcare team member is prepared to work with that and help that individual have a positive healthcare experience. Then again, diving a little deeper, the treatment itself can be trauma-informed, recognizing that some people with trauma have difficulty coming into appointments, so additional supports, recognizing that some people with trauma have a difficult time trusting healthcare providers, so a little additional time explaining things. And then in talk therapy, like cognitive behavioral therapy, that therapy itself has some specific changes that we make to make sure that it's tuned for somebody who's experienced trauma. Now, that was a lot to cover pretty quickly to get to the question that I'd really like to talk about today, which is, why is it that healthcare delivery systems struggle so badly with trauma-informed care? To get to the answer, I think we have to understand a little bit about healthcare providers and usually what motivates them. Most people who go into medicine view themselves as being there to help other people. And the normal dynamic of helping is you kind of expect gratitude in return. On some level, I think we know that's unrealistic in some cases, but that is a paradigm a lot of people who come into medicine hold. So when that healthcare provider provides care to somebody who, instead of being grateful, is avoidant, fearful, and potentially rejecting, that healthcare provider will probably experience that dynamic in a pretty challenging way. And without proper understanding and training, might become irritable, angry, and rejecting of that patient. I'm sad to say that I've seen that happen more times than I can count. With proper education and proper training, I think they have a chance to adjust that strategy, to recognize that people show up to care with all types of attachment styles and with all types of histories, with trauma and without trauma, and that if somebody isn't immediately grateful for the care they're receiving, then they might have a strategy that's just a little less familiar to that provider. So for me, that mostly explains why the individuals within healthcare struggle. But trauma-informed care is about much more than the individuals in care. It's about systems of care. And the challenge with systems of care, I think it goes a little bit deeper. And mostly my experience is that healthcare systems are built on an economic model. And that economic model is that they deliver healthcare, they receive payment, and they try and make ends meet. So additional costs in the form of human resources or additional training might be viewed by a clinic manager as an expense and not as something positive for healthcare delivery. That perspective would be dramatically different if the clinic had a population view. When a clinic takes a population view, they understand that they have to deliver care to a certain population, and the success of the clinic is based on the success of their healthcare delivery to that population. And what we understand about trauma is that so many people have experienced trauma that if you don't address it, a significant percentage of patients just don't receive adequate health care. So if that clinic doesn't address trauma-informed care, they simply wouldn't be successful in healthcare delivery for that population. So what it seems to really come down to is the healthcare systems view themselves as treating populations or kind of cherry-picking relatively easy patients who don't have some of the more complicated issues that might come along with trauma. So summarizing, I think there are two major reasons why healthcare delivery systems really struggle to implement trauma-informed care. Number one, the individual providers sometimes lack the training or understanding of how trauma expresses itself within the trust and attachment style of individuals. So a little bit of training, a little bit of support probably could go a long way. Then issue number two, which is quite frankly more complicated, the healthcare system is built on a fee-for-service model. So people who might require extra support or better understanding might not get that understanding as long as healthcare systems view trauma-informed care as a financial burden and not what it really is, exceptional healthcare delivery. It'll be difficult for healthcare systems to make the transition. I view deploying trauma-informed care across healthcare systems as one of the core changes needing to be made to take our healthcare systems to the next level of quality, and I'd like to see us deliver on that promise. Thank you so much for joining me today. If you like the content, please give it a thumbs up, and if you'd like to see more content like this in the future, please subscribe. I'd love to have you. Thank you so much.